And moving on now to Paul Moulton from Isle of Man Television. Good afternoon, Paul. Fast am I.
Thank you. In your introduction speech, you said staffing pressure at the hospital, which was of particular concern a week or so ago, continues to be closely managed, but is currently stable. Is that correct?
That's right, Paul, yeah.
So I've heard from the North West Hospital Trust, I believe you're part of that, the Platinum group that gets together each morning. You've made a request or potential to look into the possibility of getting critical care nurses deployed to the Isle of Man. Can you confirm or deny that is a potential in that? And that doesn't add up to what you just said, that everything's under control.
Well, it does if you listen to David's explanation.
Yeah. Thank you, Paul. This isn't unusual. We've done this before when there's been winter pressures, where that's the whole point of us being part of the North West network. It's not, critical care nurses is one of the areas, because that would actually potentially allow us, when we look to reopen things, to be able to get additional support to allow us to reopen it. So even at the normal times, we'd be under pressure because of the number of people that are in hospital isolating. So this isn't something unusual. We've done it before with winter pressures, without COVID, where we've looked potentially to use the North West network. There's certain key areas where we would want to get additional support in, but it's actually just a sounding to see if that support is available if we wish to call on it. We haven't actually at this moment in time physically called on it. And it's important. So it's important that we have that ability to do so if required.
So can you confirm you did make that request or looked into it at least this morning? And that's unusual from the people I've got this information from, that it's the first time you've asked for it. Something's going on, is it not, that you need this extra backup?
Absolutely not, Paul. My understanding is it's not unusual. We have done it before. We've done it in ordinary times. And the request wasn't made this morning. The request, I believe, was about a week and a half ago.
Okay. Second question, it leads on to slightly the variant we're seeing, the people on ventilators. I believe that you said there's 3 today. I'm hearing that it's particularly this is a much different sort of amount of treatment that's needed compared with last time, and these people are actually on the machines much more. Can you confirm that this is the case, that it's really much more serious than the last outbreak?
Well, actually, Paul, no, because if someone's ventilated, they are permanently ventilated. It's not something they keep putting in and removing. They're on it permanently. So it's exactly the same as the previous outbreak.
Sorry, they're on longer then, I should have said. They're on for a much longer period.
Well, no, that depends upon the patient. We've had several patients, as you will have seen from the figures, that actually spent what for ICU purposes would be a very relatively short period in ICU. There's no trends emerging from the figures I've seen that suggest anyone being admitted to ICU with new variants is there any longer than anyone was in a similar sort of condition with the old version.